You know that slightly awkward, stiff walk you sometimes see in a dog?
Yeah.
Or maybe you've heard about a pet, perfectly healthy 1 minute, then suddenly weak, unsteady.
Yeah, it can be really worrying for owners.
Exactly. So today, on the deep dive, we're going to unpack a condition behind some of those cases. Coonhound paralysis.
Right, also known as acute polyradiculoneuritis.
Yep, in dogs.
Yeah.
And it's more than just a simple limp or something. It's quite a complex reaction happening in their nervous system.
It really is.
Yeah.
And it has some surprising potential links to human health, too.
That's what we're getting into. We've got some excellent sources here detailing, the definition, causes, symptoms, treatment, the whole picture of CHP.
And our mission really is to explore all that, sort of distill it down so you come away feeling well-informed about coonhound paralysis.
And why it matters beyond just, our canine friends.
Precisely. Understanding its significance.
And you mentioned that human connection, which is fascinating. It's linked potentially to something called Guillain-Barré syndrome in people.
That's the proposed link, yes. It makes studying this condition in dogs particularly valuable.
Okay, intriguing stuff. Let's dive right in then. What exactly is coonhound paralysis? Lay it out for us.
Okay, so in essence, coonhound paralysis, or CHP, is an acute inflammatory disorder.
Acute meaning it comes on suddenly.
Yes, quite suddenly. And it affects the nerve roots, where the nerves exit the spinal cord, and also the spinal nerves and peripheral nerves themselves, the whole network outside the brain and spinal cord.
Got it. The wiring, basically.
The wiring, exactly. Now, the classic association, hence the name, is with contact with raccoon saliva.
Right.
But interestingly, it can also pop up after a recent vaccination, or even following a gastrointestinal bug or a respiratory infection.
Ah, so the raccoon thing isn't the only cause. I always thought it was just that.
That's a really common misconception.
Yeah.
Raccoon saliva is a known trigger, definitely. But there's also this other condition, clinically identical, called acute canine idiopathic polyradiculoneuritis.
Idiopathic meaning we don't know the exact cause.
Yeah. Exactly. ACIP. Same signs as CHP, but no raccoon contact history. And in those ACIP cases, we often suspect maybe a recent infection kicked things off.
Okay.
And then, much more rarely, you can see what's called post-vaccinal polyradiculoneuritis.
Following a vaccination.
Correct. A temporal link, anyway.
Okay, so several potential starting points, but they all lead to this similar nerve inflammation. What's actually happening inside the dog? What's the mechanism?
Well, the exact precise cause isn't fully nailed down, but the leading theory points towards an immune-mediated process.
The dog's own immune system is involved.
Right. So picture this. Maybe 7 to 14 days after one of those triggers, the raccoon encounter, the shot, the infection, something goes a bit haywire with the dog's immune system.
Haywire how?
It seems to mistakenly identify parts of the dog's own nerves as foreign invaders. The idea is possibly something called molecular mimicry.
Molecular mimicry. Sounds complex.
It does, but the concept is sort of like a case of mistaken identity on a molecular level. So maybe a protein from the raccoon saliva, or from a virus or bacteria, looks very, very similar to a component naturally found in the dog's nerve tissue.
Like wearing the same disguise.
Kind of. So the immune system mounts an attack against the real invader, but because of that similarity, it also attacks the dog's own nerve cells. Specifically, certain fatty molecules called gangliosides seem to be targets.
And that leads to autoantibodies, antibodies against the self.
Precisely. Autoantibodies are formed, and they damage the nerves. In classic CHP, that link to raccoon saliva is pretty strong.
Okay.
For ACP, the idiopathic form, it's less clear-cut. But maybe a previous respiratory or GI infection act as the trigger. Interestingly, dogs with ACIP seem more likely to test positive for Toxoplasma gondii, that parasite.
Huh. Another potential piece of the puzzle. So this immune attack, this mistaken identity, which nerves get hit the hardest?
It's primarily the peripheral nervous system, again, everything outside the brain and spinal cord. The ventral nerve roots, specifically, often bear the brunt.
Ventral meaning the motor ones.
Yes, the motor pathways, the ones carrying signals out to the muscles to make them move. That's why we see the weakness and paralysis.
Makes sense.
And it often seems worse in the lumbosacral area of the lower back, controlling the hind limbs compared to the neck and chest.
So back legs often affected first or worse?
Often, yes.
Yeah.
Though it usually progresses. We can also see cranial nerve involvement sometimes.
Nerves coming directly from the brain.
That's right. Nerve 7, the facial nerve, is the most common one affected. Maybe some issues with nerves 9 and 10 too, involved in swallowing and voice.
Okay.
And the really serious concern is when the nerves controlling breathing get involved, the intercostal nerves between the ribs, and the phrenic nerves to the diaphragm.
Because that could lead to respiratory failure.
Exactly. That's the most life-threatening complication.
Right. Scary stuff. So, shifting to what an owner might see, what are those first signs? How does it usually start?
Well, typically signs appear about, say, 7 to 14 days after that potential trigger event.
Okay, that 1 to 2 week window again.
Yes. And the first thing owners often notice is just a change in gait. Maybe a bit stiff, stilted, almost like they're walking on eggshells.
And you said usually starting in the hind legs.
Often starts there, yes, and then progresses, often quite rapidly, to affect all 4 limbs.
How rapidly?
We're talking maybe over just 2 to 4 days. A dog could go from slightly off to significant flaccid, meaning floppy weakness, or even paralysis in all legs.
Wow, that's fast.
It can be, yes. Other things owners might notice, a change in their bark or voice might sound weak or hoarse.
Okay.
But importantly, their appetite, thirst, urination, defecation, those usually stay normal, especially early on.
That's good to know. So even if they're struggling to move, they're often still bright and eating.
Generally, yes.
Hmm.
Mentally, they're usually alert. But the weakness itself can continue to worsen for maybe 5 to 10 days after onset.
So it might get worse before it gets better.
That's often the case. Yeah. Now, when a vet does a neurological exam, they're looking for specific things. The weakness is typically symmetrical, affect both sides fairly equally. Reflexes are usually decreased or totally absent, except maybe the peroneal reflex around the tail area. Muscle tone is often reduced.
Floppy.
Floppy, exactly. In severe cases, they might not be able to lift their head. We'd check for those voice changes, maybe facial weakness like drooping lips or inability to blink properly. And, crucially, assess their breathing effort.
Okay.
But here's a key point. Pain sensation is usually intact. They can still feel things. Sometimes they might even be more sensitive to touch. That's called hyperesthesia.
So they can feel, they just can't move properly.
That's the crux of it. It's primarily a motor dysfunction. You might even see a paralyzed dog that can still wag its tail.
Really?
Yeah, it happens. And again, mental status, peeing, pooping, usually unaffected.
Okay. So if an owner sees these signs, heads to the vet, what's the diagnostic process like? How do they confirm it's CHP or ACIP?
Yeah, that detailed history and the neurological exam findings are really crucial first steps.
Putting this story together.
Yes, exactly. Basic blood tests, urine tests, usually normal, which is actually helpful because it rules out some other things.
Right.
But they're more specific tests. Sometimes levels of certain antibodies, like IgG, might be up in the blood. Then you have the immunological tests.
Like the raccoon saliva test.
Yes,
Yeah.
the ELISA test for reaction to raccoon saliva antigen. That would likely be positive in true CHP, but negative in ACP without raccoon exposure.
Okay.
And in some ACP cases, they might look for antibodies against those nerve components, the GM2 gangliosides we mentioned.
Gotcha. What about imaging, x-rays, ultrasounds?
Usually normal. They're mainly done to rule out other possibilities, like maybe something compressing the spinal cord, although that usually presents differently. Chest x-rays are important, though, to check the lungs and breathing muscles.
Right, for that respiratory risk.
Exactly. Then we get to more specific nerve-related tests. Cerebrospinal fluid analysis in hour. CSF TAP is often very informative.
What do you look for in the CSF?
Typically, you find high protein levels, but without a big increase in white blood cells. It's called albuminocytologic dissociation.
Okay. Why high protein?
It's thought to be due to leakage of protein, like albumin, from the blood into the nerve roots because the inflammation disrupts the normal barrier there.
The blood-nerve barrier. Makes sense.
Then there are electrodiagnostics, EMG electromyography.
Testing muscle electrical activity.
Right. And nerve conduction studies, measuring how fast signals travel along nerves.
What do those show?
EMG might show signs of denervation muscles losing their nerve supply, though these changes can take a little while to develop. Nerve conduction studies often show problems with the motor nerves, and particularly slowed conduction or blockages near the nerve roots.
Supporting that nerve root and peripheral nerve damage idea.
Precisely. And while not usually done live, if you were to look at nerve biopsies, you'd see things like nerve fiber damage, loss of the myelin sheath, the insulation, and inflammatory cells. And critically, the vet needs to rule out other things that cause similar rapid onset weakness. Tick paralysis is a big one. Botulism too, and other types of acute polyneuropathies. So differential diagnosis is key.
Sounds like quite the detective work. So once you've pieced it together, landed on CHP or ACIP, what's the treatment plan?
Well, this is where it can be frustrating. because there's no single proven cure or medication that reverses the process quickly.
No magic pill.
Unfortunately, no. Now, for some ACIP cases, there's been use of intravenous immunoglobulin IVIG.
Like giving concentrated antibodies?
Sort of, yes. The idea is to modulate the immune response.
Mm-hmm.
If given very early, it might shorten recovery time, but the evidence isn't definitive and it's expensive.
Okay. What about steroids? Anti-inflammatories?
That's a really important point.
Yeah.
Corticosteroids are generally not recommended.
Oh, why not?
There's evidence, including parallels drawn from human Guillain-Barré syndrome, that they might not help and could potentially even be harmful or worsen the outcome.
So steroids are out. IV is a maybe sometimes. What's left?
Supportive care. That is the absolute mainstay of treatment.
And what does supportive care look like in practice?
It means really intensive nursing. First, super close monitoring, especially respiratory function. Some dogs need mechanical ventilation if they can't breathe on their own.
That's intensive care unit level stuff.
It can be, yes. 5D fluids are often needed for hydration if they're not drinking enough or can't get to water. And then meticulous nursing care,
Like what?
helping them eat and drink if they can't manage, turning them frequently every few hours if they can't move to prevent pressure sores.
Bed sores, right?
Exactly. Keeping them clean and dry, managing urination and defecation if they're recumbent, using padding. Physical therapy is also crucial.
Even if they can't move much.
Yes, passive range of motion exercises to keep joints flexible and help reduce muscle atrophy, muscle wasting. As soon as they can tolerate it, helping them stand with support, maybe hydrotherapy later on.
A lot of hands-on work.
A huge amount. And that's where client education is so vital. Owners need to understand this isn't a quick fix. It's a long haul, potentially weeks or months of demanding care.
That's a big commitment.
It is. But the good news, the really encouraging part, is that most dogs do recover fully.
Oh, that's great to hear.
Yeah, typically over maybe 3 to 6 weeks, they gradually regain strength. Severe cases might take longer, months even, and occasionally recovery might be incomplete. Some residual weakness might remain, but full recovery is the most common outcome.
That's hopeful. So it's tough, but there's a good chance of getting through it with dedication.
Absolutely. Patience and nursing care are key.
Okay. What about prevention? Can anything be done to stop it happening?
Well, for classic CHP, the obvious advice is to try and minimize contact with raccoons, though that's easier said than done sometimes.
True. Raccoons can be sneaky.
They can. For those very rare post-vaccinal cases, the advice would be to avoid that specific vaccine in the future for that individual dog, working with the vet on alternatives.
Makes sense.
And, this loops us back to that broader implication we mentioned at the start.
The Guillain-Barré connection.
Right. CHP in dogs is considered a really valuable spontaneous animal model for Guillain-Barré syndrome, or GBS, in humans.
Why is that? What are the parallels?
Both are acute peripheral nerve disorders. Both are thought to be immune-mediated, often triggered by a preceding event like an infection. Both involve inflammation and damage to nerve roots and nerves, leading to weakness or paralysis. Studying how CHP develops and progresses in dogs and how they respond to different supportive measures can give us real insights into GBS.
That's incredible, learning from our pets to help understand human disease.
It really highlights the One Health concept, the interconnectedness of human and animal health.
Definitely. Okay, let's try and wrap this up. What are the absolute key takeaways from this deep dive?
All right, so coonhound paralysis, CHP, and its idiopathic cousin, ACIP, are serious acute nerve inflammations in dogs.
Causing rapid weakness or paralysis.
Exactly. Triggers can be raccoon saliva for CHP, or possibly infections or other unknown factors for ACIP. Diagnosis relies heavily on the clinical picture, neurological exam, and often CSF analysis or electrodiagnostics to confirm nerve involvement.
And rule out lookalikes like tick paralysis.
Crucially, yes. Treatment is primarily intensive supportive and nursing care. Steroids are generally avoided.
But the prognosis is often good with time and care.
Yes. Most dogs recover fully over weeks to months, though it requires significant dedication from owners and veterinary staff.
And the big picture link?
CHP serves as an important animal model for human Guillain-Barré syndrome, potentially helping us understand that condition better.
It really makes you stop and think, doesn't it, about how these immune responses work or sometimes misfire.
Absolutely.
And considering all these potential triggers, infections, maybe environmental factors, maybe even individual genetic susceptibility, it does make you wonder what else might be contributing to these kinds of neurological issues, both in our animals and in us.
That's a great point. There's likely still a lot we don't know about the complex interplay between genetics, environment, and the immune system in these types of disorders.
Definitely food for thought. Well, this has been incredibly informative. Thank you for walking us through the complexities of coonhound paralysis.
My pleasure. It's a fascinating and important condition to understand.